Good afternoon and welcome to Harvard Chan Studio. I'm David Garcia, co-founder of Amigdala Boston and Director of Entrepreneurship and Innovation at Real Colegio Complutense at Harvard University. I'm joined today by 4 fellow alumni and entrepreneurs who are changing the way we think about innovation and public health. I'm pleased to introduce to Fiza, MPH 22, co-founder and CEO of Patient.AI, Hsiao, MPH 24, founder and CEO of Trans Health HQ and instructor here at the School of Public Health. Nigam, SM 23, co-founder and CEO of basys.ai, and Hailey, Hsiao, MPH 25, founder and CEO of CareCorgi and startup advisor at Blackstone Entrepreneurship Network. Let's start with one question for all of you. What inspired you to become an entrepreneur, and how did you decide to start your company? Please.
Perfect. I'll go first. So my startup entrepreneurship journey actually was driven by a personal story where someone in my family had actually lost her paper-based medical records, and that prevented her from getting care at time, and she passed away. So when I experienced this firsthand, I was actually, it was just right before my MPH degree, and I came into the MPH degree thinking of what I can do to solve this problem. And one of the basics of First.AI at that point was how do we digitize the end-to-end patient care in emerging markets, starting from Pakistan, where I was from.
Amazing. Hi everybody, good afternoon. My name is Yvonne and I started Trans Health HQ because I'm trans and I know the stakes of receiving gender affirming care. I know that I would not be speaking with all of you right now if I didn't get access to care, but it definitely took me hundreds of hours, a lot of conversations with my doctors, a lot of self-advocacy, and I feel like I could only do this because I worked in healthcare for 7 years, had access to clinical literature, was relatively confident speaking with clinicians, and these are just not the privileges that most people have, let alone the trans community. And so having been through the process myself of receiving gender affirming care and helped a lot of my community and friends through a volunteering basis, I knew that something needed to change about our healthcare. And I'm sure all of you have heard about the defunding that's happened, the attacks on the trans community. And so the need is greater than ever, and that's why we've built a digital care navigation platform to help accelerate trans community members' access to quality affirming care.
Thanks. Hi everyone, my name is Amber, and I started my company because of both professional and personal experience. So my dad had diabetes, and over a period of time it progressed into much worse case of diabetes, and he also had certain heart conditions, etc. So being his caregiver, I got the first-hand understanding of what it looks like and how much anxiety it causes. And there can be different diseases that you might have, and they might cause different anxiety. So that was one of the reasons of getting into healthcare. But I also have an undergrad degree in computer science, and I like problem solving. So once, and this is, by the way, my second company. So the first company was founded, which was purely on machine learning and data science, but for this particular company, the focus has been to work at the intersection of data science, or problem solving, and healthcare. I would also say when I first came to the school, which was almost 3 years ago, I knew that I wanted to found the company, and my first Slack message was, I'm interested in founding a company and we'll figure out ideas. I just need smart people to work with. So just having a sense of direction on day one of the school really helped. But even from the high level perspective, as we progress from day 1 to day 100 to day 1000, I think Harvard has played a critical role in finding the right opportunities, connections with the investors. And we'll talk all about that. But it has been a very steep learning curve.
We're going to build out on that too. I've been extremely entrepreneurial since I was really young. I grew up in the slums area in Malaysia. Did not have a lot to trade, but I would pick up different rocks and then market it and give meetings to the rocks so that I can trade with the people around me. I started very young, and the reason why I'm extremely passionate in healthcare is because growing up, I have never met anyone in my family grow older than 70 years old, because everyone died due to poor health prior to that. During COVID, the government introduced a new code that allow hospital to bring care into people's home. I took advantage of that opportunity and founded my first company, which is Hospitalist at Home company, that we scaled to thousands of patients in the rural area. And I came into Harvard, came to Chand with that company, and about 2 years, and a year ago, founded my second company, which is building the operating system for family care.
You both mentioned Harvard. How did Harvard network and resources help you to get started?
Absolutely. I feel Harvard has, like I said, played an amazing role in connecting the dots between the intent to found the company to actually founding the company and finding the right talent and finding the capital, and I can go on and on. But one of the strategies that actually worked quite well for me was to almost like create a matrix of what I want and what are the specific resources at Harvard. And of course, when I formed the matrix, it was very sparse. I did not have any understanding of where those resources are, how do I get connected, and so on and so forth. But you have to understand, as a student, you have to start somewhere, and once you have that seed ready, once you can talk about your company, you have your elevator pitch ready, etc., people will see that you have the right intent and you are willing to spend the time, effort, resources, etc., required to found the company, and they will make those connections. So first of all, I would say I was connected to amazing people who had done amazing work, and Boston is a great community to be connected with those people who have done amazing work and have been there in the market for decades and have gained so much more experience than you might have. So that was extremely critical for me, and I feel many of these people are very humble and modest. So when you reach out to them and they might be in their 70s or 60s or 80s, and you might think of, when I'm at that stage, maybe I'll just retire. No, I don't think that that's true with everyone. So I was lucky and fortunate to be connected with certain people like that. Second perspective was also to be around other students who want to found the company and understand from them and learn from them what is their pathway to entrepreneurship, how are they thinking about things, and connecting with diverse set of students at Chan, business school, MIT, etc. was a great door opener for me. And the third and the final perspective that I would also share, and by the way, I can just go on and on, but I'll try to keep it short, was understanding different accelerators or different cohorts you could be a part of. So for instance, I was a part of Cheng Fellowship, and three of us have been part of Cheng Fellowship. They provided amazing resources. That is at Harvard Kennedy School, by the way, but they invite students from all Harvard campuses, so that was an amazing experience as well. And once you have all these connections, I think reaching out to the right set of capital for you is not a big deal, because one, you understand what investors are seeking or what certain investors or funders for not-for-profit are seeking. And once you understand that, I think you can tailor your pitch in a way that it makes sense for them as well, which of course requires a little bit of learning curve.
Maybe I'll build on some of the things that you've mentioned. So definitely, for sure, this network. I have called on every single person on this panel for help at some point, and so we would not have met if we were not all here. And I wanted to also speak to sort of the cross-pollination and interdisciplinary nature of just like an education at Harvard, especially at the graduate level, where you have access to these different schools. So I would say the three major things for me are: one, the network; two, the funding; and three, the credibility to do this specific work in trans health. So starting maybe with the network piece, one thing that is really important in entrepreneurship is knowing how to articulate value to different stakeholders. And I thought that was so valuable doing that across different schools, because at Harvard Kennedy School, I was able to refine the narrative of how I was explaining the importance of trans healthcare in like 10 seconds to audiences that had just like very gender literacy, which is super normal. At HBS, I was fortunate enough to have won a runner-up at the New Venture competition a few years ago, and that gave me funding, but also access to mentors who helped me like go to market strategy and help me understand how do you sell into hospitals and health plans so that you're not charging users, but you are embedding your solution into institutions, which gives it a layer of protection that does not happen when it is institution agnostic. And I would say for sure, bringing it back home to the Harvard School of Public Health, I came back here because I love my department. Shout out to Social Behavioral Sciences and the Women, Gender, and Health concentration. I came back here to be reminded of why I do this work when things get really hard. I am a trans person, so it's a little bit difficult. It still stings a little bit when I go to other schools and sometimes people say there's not really an economic reason to address the population, this tiny population's healthcare, etc. And so I really appreciate being able to come back here and just know that I will have values-aligned community that will back me up no matter what.
Absolutely. Public health students, they have the domain expertise, but some of them feel they don't have the technical expertise or the financial markets expertise. What would you advise for them to start building today?
I think the things that we need to start today, the bar is very different compared to many years ago. With AI, there are tons and tons of tools at our disposal, right? If you have an idea, use tools like Rapid, Lovable, V0 to be creating your prototype. Bring it to either your users, your consumers, and which are both different, especially in healthcare. People who are paying might not be the people who are using. But bring your tool to your user early, test it with them at a fractions of the cost. An example I can give is at my first company, Origin Healthcare, which is a hospitalist at home company, we spent $250,000 to create our first versions of applications. And the process was different. The process was we designed online with a group of designers, and then we built, and then we take it to the customers. Whereas in these days, within 30 minutes, you can talk to tools like Replit, you can talk to tools like Lovable, create your idea, create an MVP, and then use that to test with the customers, iterate it, see what people like, what people don't like, before you spend any more money into building it. So the cost of entry is different today. You don't need a lot to start. Yeah.
Mm-hmm. And for the students who are currently at the school right now, how would you recommend to focus their coursework and time?
So when I came in as a student, I think having a very clear objective and goal is important. Yes, you want to pursue entrepreneurship, but what do you really want to do, right? Do you want to look for a co-founder? Do you want to raise funding? Do you need to think through of how to manage different stakeholders? There's definitely skills that you might be lacking and you want to work towards that. So when I started my journey at HSPH, I had recently started my business and we wanted to sell to, there were two main goals that I had. The first goal was that I want to sell to these large healthcare organizations in Pakistan, so I need to understand how the policy and the healthcare organizations really look at incentive models, right? So I took a lot of health policy classes to understand how do health systems and global health work, how do you think about incentivization, how am I supposed to have these conversations with them, how does this P&L work, right? So all of that really helped me understand health systems as a huge and how to sell to them, right? And that's a skill I still have, and as we pivoted to the US, it's still very relevant for us today. The second thing was that I knew we were making a lot of on-ground progress. We had around 3,000 users or patients using our platform at that point in Pakistan. But I knew for us to excel, we needed fundraising, right? And even for me to pivot to it full-time after graduation. So the other thing I did was I was like, okay, I need to fundraise. The first thing is, how do I do that? Right, so I started to enroll myself in all the classes at HSPH. There's an entrepreneurship club by Rick Siegert's. Then I enrolled myself at the MIT Healthcare Ventures class by Zen Chu. And then I enrolled myself at the iLab. And so all of those three, what I would do is I went through the process of making my first version of the pitch deck to pitching to 70 people right after by my second semester. And by the 71st person said yes to me. And one of my actually professors at MIT Ventures class became my first investor in. So by the time I was in my second last semester, I actually had funding from Pillar VC around the area who had invested in us for me to transition to my venture full time. So going back, I think, like I said, it's like understanding what objective you're coming with and what are the skills you need in order to fill that gap, so that after graduation you can actually pursue entrepreneurship full time and make that risky step rather than think through it as, oh, it's still a maybe. And I think having that clear goal really helps.
Yeah, and building on top of what just Fiza mentioned, I think by this point in time you would have seen there are certain patterns that have been emerging in all our journeys. But of course, like each data point has its own nuances, and sometimes you feel like, oh, entrepreneurship is so exciting, it's so much fun, and so on and so forth. And David and I were talking, and others were involved as well, and we were talking about the kind of heartbreaks that we have to go through. And I think Fiza just mentioned that she had to go through 70 heartbreaks. I had to go through probably like 150. Fiza, of course, is much smarter, so she did it much faster and better.
That's what I like to think.
But it has been an exciting process, and I feel if I have to define when you're coming into this coursework, the grad school or undergrad as well, I think there are three typical props that you need to address when you're founding a company. You need to test enough hypotheses, test enough ideas, because most of the time you're invalidating your hypotheses rather than validating. It's something to do with probability. The second part is you want to be in the right circles, because not everyone who's coming in has the intention of founding a company. And if you have, you need to figure out the people who you should be connected with. Now, those could be fellow founders, could be professors who are in entrepreneurship. There are professors in entrepreneurship in Chan, HBS, MIT, so on and so forth. So that's the second part. And the third and the final part is just networking and connecting with different resources. And I'll not even call out investors. I will say a lot of your classmates, they might end up joining your company. For instance, we had our first hire. First of all, my co-founder was a Harvard Chen alum, so I found my co-founder there. My chief of staff was an HBS MBA, and then we had like similar MIT folks joining us, folks from engineering school joining us, graduate school of design helping us out, and so on and so forth. And some people stuck, some moved on. But the whole point of this is you're not founding a company at a particular point in time. It's a longitudinal process. And any data point that comes across as valuable, you would want to use that and leverage that. And I think the best part of being at the grad school or at Harvard is when you are doing something, there is amplification like this happening. So take full advantage of that is what I would say. But overall, I would also mention that this is one data point out of so many data points, and you'll carve a path for yourself. So while we are all here giving advice, I think many of us did not take 99% of our advice, and we followed and charted our own path.
It's an exciting journey. A lot of public health students ask us often, what can they bring to the table? Why they should get embarked in entrepreneurship? What could you tell them about this?
Yeah, maybe I'll get started on this. I guess when I think about public health students, I think about three main things. It's tenacity, it's integrity, and it's deep expertise and knowledge. And so much of the job of public health practitioners, researchers, is to make the invisible visible. I don't need to tell anybody on this panel, everybody of whom has at least one minoritized identity, that discrimination exists. But there are people out there who don't believe that that exists and don't believe that that has very direct links to our health outcomes. And so to be able to do this work, you have been able to look at very profound problems in the eye, and you have stuck to looking at that in a way that a lot of people would then choose to look away. And so this tenacity that you bring to the table and the deep knowledge that you have about problems that you're very passionate about, this is really important for you to contribute to the solutions that are being built to address these problems. Because there are people of other industries who do not have that public health background who would very much benefit from your expertise to actually design solutions that will be integrated into clinical workflows and therefore actually used by doctors and care teams. They will really value your expertise to design for end users these patients and communities that you care about in a way that otherwise maybe they wouldn't have. It might have been more of an afterthought. And so that's why I think it's really important to bring that to the table so that we can actually work together with other industries to enact systems change.
Let's change topics. Let's talk about funding. This is an overwhelming word. What kinds of capital are there? What types of funding can public health startups find?
Yeah, I think a lot of entrepreneurs think that VC's funding is like, because there's a lot of headlines around it, is one of the few ways to get there. But the reality is there are multiple ways to get funding, right? There's bootstrap funding, which is taking your own money. There is loaned. You talk to a bank officer who cares about certain type of return and different risk profiled. There's friends and family, there's angel investors, there's VCs, there's accelerator, there's grant. Each of these capital expect different things, have different risk profile, and have a different goal themselves. So I'll give you an example. When I started my first company, a hospital-at-home company, Origin Healthcare, I knew from day one that that company is not a VC-backed company. There's no way by building a hospital I can fulfill, and that's not my goal too, to do 10x return by a certain amount of time, right? I want to make sure that in my clinical care, we are taking a safe, stable route for our patients. So I'm fortunate enough to have spent 10 years at Google, where I've saved up. And then so for Origin Healthcare, it was primarily bootstrap, using my own money and loan as well as grant. Whereas for my second company, I'm building it for scale. And so the capital that I will be looking for is extremely different. So I think when we are thinking about our company, it's also vital to think about the type of growth, the type of capital vehicle that is best for that.
Yeah. And maybe building off of that, Hailey covered sort of the commercial fit, and I'll also introduce another dimension of just fit for the social impact that you're looking to achieve as well with the venture. And so I'll share a little bit more about building Trans Health HQ here. So I purposefully started with non-dilutive capital, meaning that the money that I would receive, for me, I wanted it to be values aligned. And so, for example, would decline receiving funds from funders maybe who were funding surveillance technology that is currently harming our neighbors. And that also meant that trans people could retain decision-making control at my company at such an early stage. Because in the early stages of building a startup, you are exploring what solution might fit best. And for that to be colored by expectations of financial returns, it is impossible to completely decouple engaging with healthcare as a business in America and working in this field. But there is a certain level of protective buffer that I wanted for Trans Health HQ, which is why we went for non-dilutive funding. And I felt very grateful that at Harvard, we were able to receive awards. For example, at the Harvard Innovation Lab, there was the Social Impact Fellowship Fund. We were Chang Fellows, or Social Innovation and Change Initiative Fellows now. And that gave us also a stipend to work on our work, and all of that just gave me a little bit more runway to build a offering for the trans community that had no viable commercial potential in that it was just the start of our work. And so for that reason, we pursued a lot of grants, started funding fellowships, but then we also started looking into, like angel investors who may be a little bit more patient with the capital once we started building our solution for hospitals and health plans. And of course, there are other ways as well, like crowdfunding, crowdsourcing, but it really comes down to what is a good fit for the solution you're building. Is there a market appetite for what you're building? And lastly, what are you sort of naturally good at as the leader of this initiative?
And if I could also quickly add a point, I think one of the things that I've noticed while being at Chan and in public health, sometimes we tag VC funding to be bad funding. It's not always the case. And I think, for instance, we had capital from Eli Lilly, the largest healthcare company in the world, Mayo Clinic, really large health system like you would know. And they've been amazing partners. So taking capital from the right partners is crucial. While some VCs will, of course, push you in certain objectives and direction that they want because that is what their job is. I think you can be mindful of choosing between different kinds of funding and even between, let's say, different subcategories of funding as well. So while if you're a for-profit company, you might want to raise a VC round because of certain connections that you might build over a period of time and so on and so forth. But even from the work perspective, when you're starting very, very small, having certain strategics help you land certain contracts. So consider that part as well. So while you're building your company, like Ivan mentioned, and we've been talking about this as well, knowing your audience is really, really crucial.
And I think I'll just add one more point to it. Strategic investors are great too. In my experience, what's really helped is VC people who have been operators themselves, right? And that specifically in early stage is key. And all of my investors came with people who had actually built and scaled companies and now have a VC fund. So they exactly know what it is like to be in your shoes. And that changes the perspective, the game, and the kind of insight and help they can provide you at that point. And it doesn't seem at that point taking money from them. It's actually beneficial because it's an added resource for you. And they're vouching for you at the same perspective rather than the way that we look at funding. And I think I've been very lucky to have those funders around the community who came in. And I think their operating experience has helped me tremendously too.
And building on this, public health entrepreneurs often face the challenge of balancing social good and financial sustainability. How do you navigate this tension?
Maybe I can start. And so TransHealth HU, I mentioned earlier, is a digital care navigation platform for the trans community. We have two offerings. So the first is a access and information hub used currently by about 18,000 people around the world, majority in North America. It is a free resource that offers trans health and wellness information that is curated by a fully trans team. And on the enterprise side, we support health systems and health plans with care navigation, so having various care pathways for gender-affirming care, such as reproductive health, gender-affirming hormones, surgery, etc., really supporting care teams and patients every step of that patient journey. But we would not have been able to get to the second part, I believe, if we did not start with solving a fundamental issue in trans healthcare, which is that information is frequently fragmented and decentralized, and there's a lot of misinformation out there by bad actors. And so by starting with that, we were able to build up trust with the community by truly solving an issue that all of us were facing. That gave us then the data and inputs and large network to put together these care pathways for values-aligned payers. And even just building off of our previous discussion, Blue Cross Blue Shield Massachusetts was one of my early investors, and I really appreciated that support because they helped me navigate sort of that side of the business and gave us the runway to be able to embed our solution in institutions, which is sort of that part 2 of the theory of change. And that is how we have sort of 2 arms to our solution. One that will always be free, always be for the community, and never gatekeeps information to life-saving care, and also revenue that is more dependable and not something that can be swayed by the environment. I know everyone in this room is no stranger to the defunding that has happened in public health and sort of the instability that might come with certain types of funding. And so revenue has given us a bit more of a dependable source of income to make sure that what we're doing for free for the community never goes away.
Do you want to add?
We started a little differently. For my second company, it was very important to me to find a solutions that can scale fast while at the same time being able to deliver care at the lower cost. And as I mentioned earlier, using artificial intelligence. So one of our products is a AI phone line that I've trained specifically with 101 care management framework. I train my AI to know that, and families today, there are thousands of users, can call just a number, right, 808 number that you can call in and chat with the phone line as if there is a virtual care managers on the other end. And the cost of the build is manageable on our end, but the impact can scale very, 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 very quickly. So to come back to your questions, the way that I start is to start by finding where there is alignment and start there before I scale. Yeah.
We mentioned strategic investors and mentors. I want to ask about mentorship. What role has played mentorship in your journey? And how can students find a right mentor?
Yeah, I think there's no way for you to excel if you don't have the right ecosystem and support, right? Entrepreneurship is not a one-person play here. You need different types of mentors and support groups, right? So the first one might come from your academic professors that you're taking classes with, and it might come from other classes outside the School of Public Health that you're taking. Just like I talked about, my first professor actually became an investor, right? So there are people like that who can guide you through the journey. I did an independent study with one of my academic professors here, who was able to help guide me how to make my first sale into the company, right? So every professor might come in with different kind of expertise, and how can you use that mentorship, like going and asking specific questions you're struggling with, so they can actually open their network for you as well. Right? So that's one thing. The second thing is also having fellow founders, right? And I think we are on this journey to find, we're always like, okay, what's the next sale that we can have? What's the next fundraising we could do? What is the next metric that we can hit? But we don't realize how difficult the journey can be in itself. And a lot of the times, a lot of our founder friends have actually gone through that first hire, first fire, how was the equity in your first term sheet? All of these questions, people who are a little further ahead have gone through. And what I did was, I was after the School of Public Health, I enrolled myself in the Alumni program at Harvard School of Public Health, which I think at the High Lab, Harvard Innovation Lab, which we were, I think, all part of. And so over there, you find similar people who are in the same stage and even beyond the same stage as you, so that you can go and ask those questions from them. I still remember the first day I had to make my first technical hire. I wasn't sure what the equity state needed to look like, right? I went back to my investors as well, and they gave me a breakdown of what industry standards was, but I really wanted to hear from a founder perspective who had just done this, and they were able to guide me through that. I still have founder therapy talks that I call myself, that I go on weekly, because there are a lot of things you might not be able to share with your investors or advisors, but you can actually vent that out, because it's probably just a problem in that day, and it'll really quickly go away and you'll mitigate it. But in that time and that data point, you do need that help and someone to just look at it from an outside perspective, tell you that these are the things that you could do, and then you're able to go solve it tomorrow. So I think just take a very cautious role in, number one, the professors that you have, the investors that you bring on board, but then also the founders, other founder community, and really build a very strong relationship, because it can go a long way in your entrepreneurial journey.
And I would also add, it's a lot about trial and error as well, and building on what Fiza just said about bringing along people who you have, let's say, taken classes with, or professors, etc. I think there's also some advantage to be received if you're also collaborating with people in the industry. So for instance, one of our, or maybe a couple of our advisors and now board members as well, are the CEOs of current health plans. We work with health plans, for example. CEO of Scan Health Plan, for example, is one of our board of advisors, and former CEO of Kaiser Permanente, or former CEO of Tufts Health Plan. They are some of our advisors and board members, and someone who founded a company, it's called Insulet, which is now a $20 billion company. They are our investors and advisors as well. But at the same time, what I would also say is, for finding these, let's say, select group of 4 or 5 individuals, or maybe 10 individuals, I've gone through 100 of advisors, board members, etc. And it takes a lot of time. It also takes building the confidence together. Like, as much as you are evaluating them in this process, they evaluate you as well. Fortunately, when you're founding a company, there are structures that help protect your interests as a founder. For instance, if you're giving them stock options in your company, typically it comes with some sort of vesting schedule. It comes with a cliff. So you're not losing out on anything, but at the same time, you don't have to invest capital while you're finding these advisors. So just being aware of the kind of advisors you want, whether it's academic or more science-based, versus someone to help you on business development, versus more research-oriented. We also have an advisor who's been a mentor to me and is an amazing computer scientist, has written his own large language model, and he's been extremely helpful. And on a similar note, a CEO running a health plan has been very helpful from a different perspective of how to sell into a health plan. Or even when we think about raising strategic capital, these are some of the, I would say, problem statements that we have discussed with them over a period of time, and we have consistently been building trust. And finding advisors is not a one-time exercise. You keep building on what you have. You keep building on different boards of advisors, board of directors, etc. So consider this more of a constant recruiting exercise.
Yeah, and there are a lot of misconceptions about entrepreneurship in general, and especially entrepreneurship in public health. What do you wish more people knew?
I would just say this: when you are stepping into the grad school, you might feel, oh, you're not enough. You don't have enough understanding, and you don't have the right network, etc. I mean, you are at Harvard. Get over it. I think the next step should be like figuring out what you really want. And if you are interested in founding a company, I think what might serve in your best interest might be to look in different schools as well and understand people who have MBA. They might not be the best specialists. You might be good at that, but they're able to explain things in a better way. So are there learnings which you can take from some other students? So that could be one. Same for the tech as well. Given what's happening right now, and given how technology is changing, which with generative AI, with agentic AI, etc., I don't think you need a tech degree. In fact, people who have tech degree have been having certain existential crisis. So think about that. Think about how quickly you can learn, and given the fact you are where you are, and you have taken this bold next step of founding a company. I think one crucial thing that we learned over a period of time was magic happens when you commit. And sometimes it might not seem like the best strategy, given you're at Harvard, you have spent so much money and capital, you need to probably get a job. If you're coming from a different geography, you probably also need to worry about your visa. But try to have those worries in like 10 to 20% of your time, and for 80% of the time, try building on what you're really good at.
Even just elaborating a bit on the skill side, I think one misconception that was sort of underneath what you were sharing, Amber, was that you need to be this like entrepreneur that knows everything, and that is just not true. You actually become the person that is needed to lead the initiative when you understand and are committed to the problem. And so that maybe leads into what I wanted to touch on, which is that I think at least when I first thought about entrepreneurship, I thought that one had to commit to like a large commercial outcome, like pick a super large market and always drive a return. And I think that's something that I wish maybe I had received a few years ago, is that it's okay to build to solve a problem, because that was the way that I entered this field. There was a problem, there was a great need, and I wanted to do something about it, because there is so much that can be done that's not policy and that's not direct service, both of which are not necessarily my skill set. And so there was so much gray space to explore, and I almost didn't really, I didn't need to commit to a certain type of legal entity or a certain color of capital to achieve the social impact that I wanted to achieve. And so if there's something that you are deeply passionate about, I hope that this encourages you to pursue it, to see it through, because the world needs these solutions more than ever.
As we come to a close, what is the one piece of advice that you will give to aspiring entrepreneurs?
I would just say, take only those advice which you feel will work in the long run, and try to filter out 99% of advice, including this one.
I'll say, if you have an idea, start talking to your customers today, test it out, and figure out if people will pay for it.
I think mine would be, it's hard because the end goal keeps changing, but for short durations, even if it's 3 months, 6 months, know what you're trying to accomplish, and then work towards that in a very structured manner so that you can rely on some outcomes, right? Just saying that I want to fundraise is not going to help, but like, okay, in 6 months, I should have generated or spoken to X amount of people to make this pitch, and then know, okay, this is getting too much and this is where I need to put a stop to it, and then have a very strong support group of founders so that they can help you keep going.
Yeah, the advice I would give to an aspiring entrepreneur is that you have more agency than you think you do. So to Fiza's point, you can break down problems into manageable steps, and so long as you're able to do that, you can build towards that world that is, the healthier world that we're all looking to do as public health practitioners. And that I hope that, there is a lot of just agency and discomfort of your own choosing, especially in a time where maybe traditional career paths are looking less stable than we once thought due to the disruption of new technologies and such. I hope that you all know that there's an incredible amount of agency and fulfillment that can be derived from entrepreneurship and founding something that that the world needs.
Well, thank you all for this fabulous conversation. Unfortunately, that's all the time that we have for today. Recording of this event will be available at the Harvard Chan YouTube page. Have a good afternoon.
Thank you.